most of the shows we do is go get your diagnostic test, be preemptive. Don't ignore pains and aches in your body because you never know what it could be. But some people, Lesley, take it a little too far, and they can turn, being prudent about their health into becoming what we call a hypochondriac. I created Species Nutrition with one mission in mind: to provide bodybuilders and serious athletes with no-nonsense supplements that work. I put my name and reputation on every bottle of Species Nutrition products. If you want to be your absolute best, join the evolution. Welcome back to another episode of Iron Therapy. I'm Dave Palumbo, joined as usual by our RX Muscle staff psychotherapist, Lesley Timbol. And Lesley, today's going to be a fun show because, first of all, how are you doing? So I know you're going back to Canada, aren't you?
I am, yes.
Canada is calling and Lesley has to go, unfortunately.
I have to go, yes.
Now, when you come to you don't stay there. You stay in Las Vegas. When you go to Vegas, what do you do? Rent like a long-term, type of thing? Because I know you usually come for months at a time.
Yeah, I mean, I rent a condo, and then I end up paying a premium because I can only stay for a maximum of 6 months. So I'll pay for the year.
What I was going to say is you're almost better off buying yourself a little something so that you can come and just stay in your own place. And then, go back when you got to go back type of thing.
Well, next time I come, the idea is I'll have a work visa in place. So I love Vegas, but I might go to Florida. I could go to Texas. So it's kind of like wherever the job is. That's where I'll go.
Right. I hear you. Okay. Well, good luck with that.
Thank
At least
you.
You're going back to Canada when the weather is nice. So or getting nicer, I should say.
It's starting to get nicer, yes.
I'm so I don't even know what the weather is anywhere because every day in Florida it's warm. So I'm always like, oh yeah, the weather's so beautiful there. They're like, my friends up north, they're like, it was 48 degrees. Jimmy said here the other day. It's not warm yet. I said, what do I know, right? I'm a Southerner now, So
nothing wrong with that.
No. So, I've been talking a lot about diagnostic tests lately because, I'm a big believer in trying to, preemptively stop problems before they occur. And, from your cardiac CT angiograms, which by the way, I just sent, I don't even know if he wants to talk about it, so I won't mention his name, but a friend of mine who does one of the TV shows with me, he went and got the cardiac CT angiogram and his calcium score was really high. Like high, like worrisome high. So now he's got to go to the next step and probably get a real angiogram done, where they put the thing up through your vessels and check your heart out because you never know what's going to happen. And hopefully, if there is a blockage or something in there, they can take care of that. So that's something that's a good thing, getting a diagnostic test, because we don't want anyone to die unnecessarily because these are things that can be preventable. And I have a guy who I did a consult with on the phone today who is getting open heart surgery. He's getting a triple bypass. He's in his 60s. He's been following a bodybuilding lifestyle his whole life. He's perfectly healthy. He's not overweight, but genetically, it runs in his family. So I did a consult with him because he wanted to know what the process was, and he wanted me to walk him through it. It's funny. I'm going to become an advocate for one of these people that they hire is so that people know what to expect from an open heart surgery before they get it done. I've become one of those.
Yep. Yeah.
I'll walk you through the process. I've done it. I know all the little tricks and trades. I know. This is kind of sick. But before I went to jail for 5 months, Lesley, I hired one of these guys, also one of these experts who was in the federal prison system before. Now what he does is he basically advises people who are going to be going into federal prison which prisons are the best ones. how to, what to do when you get there, where to align yourself with, and, basically all the pitfalls. And he's the one who told me to go to Morgantown, West Virginia. And he said, you got to get into the kitchen. And he told me everything I need to do. So I was prepared mentally when I got there, what to expect. And, it's a valuable type of thing because people do, get in trouble and they do have to go. And even if it's for 2, 3, 4, or 5 months, you want to at least know you're going to a place where it's not going to be, terrible. So same thing with, medical stuff. If you need a major surgery, it's nice to be able to talk to someone, and go through the whole process with them prior to going in there. And I did that. I did it online. My wife did the research, actually. She sent me the links and I watched some videos just so that I knew what to expect. So when I went in there, I knew I was going to wake up probably with a breathing tube down my throat. And I knew that, I should do this and do that. And it really did help me. And I actually, going through the process now, have learned even more things that I could probably pass on to other people. So if anyone out there, unfortunately, has to get an open heart surgery, you can contact me. But that's not what this show is about. Most of the shows we do is go get your diagnostic test, be preemptive. Don't ignore pains and aches in your body because you never know what it could be. But some people, Lesley, take it a little too far, and they can turn, being prudent about their health into becoming what we call a hypochondriac. Now, where is that line? Where do you cross that line, Lesley? And I mean, in your practice, I'm sure you probably, you probably help out a few hypochondriacs. How do you get people from going to be diligent to not becoming a nutcase about this, where every little time they feel a little pain or itch on their body, they think they're going to, die or something like that?
So hypochondria, so the new technical term is illness anxiety disorder. But
I figured it wasn't politically correct. It sounds politically incorrect.
I'll say hypochondriac just because people understand what that means.
I don't want you to lose your license.
No.
They like to cancel people in today's world,
So whatever you want to call this, basically it's that fear of, anytime you feel certain kind of symptoms, right, you have this fear that it's something, a serious life-threatening kind of illness, despite having very few or even no symptoms.
Correct.
So to your point, when you have some symptoms that are unusual, yes, you do want to get checked out by a doctor. When you're getting feedback, so to answer your question as far as the line, always investigate it, yes. Now, if it's the first time you've had these symptoms and you see the doctor and they're saying, no, you're fine, what else? They're going to ask you some questions. There could be some life stresses in your life that you need to work on that's either manifesting these symptoms or you're overreading things. Right. So as far as how to determine it is, how often does this pattern happen? If you're going to the doctor for the 5th time about having neck pain again, and he keeps saying it, we've done, whether it be x-rays or whatever kind of tests, and it's coming back normal every time, that's a bit of a signal. And a lot of times it's this preoccupation with a serious illness for at least 6 months. So this is something that's going to be long standing. This is kind of a chronic thing. So that's one of the determinants as far as how do you tell if it's someone, and again, you can get it checked out, but if you're constantly getting this feedback from your doctor, there's something up, that there could be something more mental that's going on.
Now, I want to preface, I know someone who's had like pain like in their GI area, and they just felt like something wasn't right. And they went to the doctor, they went to the emergency room. No one ever ran a CT scan on them. And for some reason, they said, you don't need it. There's nothing wrong with you. We ran bloods. Everything's good. We took a chest x-ray. And this person said, I just don't feel right. And eventually they forced,
good.
I don't know, I think they went to an emergency room or something like that. They forced someone's hand and they did a CT scan. Turns out they had some kind of a blockage. All right. But barring that type of situation, I'm talking about a person that every other week they're in the emergency room for something else. In other words, it's always something, a sniffle, or because they think they have like polyps in it. They're making up something. Like, I mean, let's show some real world, examples. Like our good friend Jimmy the Bull likes to go to the emergency room, and I don't know if it's because he likes to be catered to there because, they love him there. They have the pretty nurses, they fawn and, they all go all over him. They check him out. They know him. I don't know if he's going there for attention or if he actually is convinced that, that he's always convincing himself there's something wrong with him. Like he went to the emergency room yesterday. He was supposed to do a TV show with us after the Iron Raid show. And he told us at the emergency room, call you later. And did not respond to Lee, me, John Romano for hours and hours and hours. He didn't call me, matter of fact, till the following morning, till this morning. And I said, what happened? Are you okay? Oh, yeah. I was, the doctor said, I'm not sleeping enough because, he's getting up at 1 a.m. to drive the truck and he's not drinking enough. So he's dehydrated. So he was walking around like feeling all out of sorts, so to speak. And what it really was he was dehydrated and he was overtired essentially. And he thought he was having a stroke.
Yeah.
The time before he went, he thought he was having a heart attack, but he had indigestion, which was, I think he went 2 or 3 times for that reason. And so, I mean, when do you define, all right, you know what, the person is a hypochondriac or they're going for attention versus, they really have something wrong with them?
Well, it's not all or nothing. Let someone pick on Jimmy, and I do this with love, Jimmy, if you ever watch this.
You do this with love, yes, of course.
Yes. But there are times when, he's had some symptoms and it was legit. When he has those gallstones or whatever, that was something legitimate that had to be taken care of.
Right.
But do I think there's some other stuff going on with Jimmy that as far as, it's nice to get attention. If you don't have a lot of that kind of support, I mean, he kind of is making his own bed in the respect of, he wants to stay in New York. It's not exactly a positive environment for him.
No.
I know the RX crew has tried to encourage him to come to Florida, which would be warmer weather, less drama. There's
better VA hospital too. Yeah.
And again, if you can't get that, again, he's in New York. So he's getting the attention, which, and you can get lonely. I would imagine he'd be lonely. So he wants to talk to someone, get that female attention from the nurses. He should actually marry a nurse.
That's what John and Lee said. He should just marry a nurse. It would be a lot easier.
But, so I mean, some of the time, I can't say 100% blanket, he's always seeking attention. No. I think some of the time he is, but part of that is because he's missing certain other elements. So I don't feel that Jimmy's like, I'm feeling lonely, let me go to the VA. I think it's more of you were just talking about lack of sleep. Nutrition is a big piece of it. It's not the whole piece, but it's a big piece of what can contribute to people having symptoms. And when they get these symptoms, they automatically assume it's an illness when it's deprivation of, let's say, whether it be their omega as an example, dehydration with the water. You were going to say something, Dave.
Yeah, I was going to say, he's dehydrated, but also living alone. And as you get older, you start getting paranoid because there's no one else there to bounce ideas off. So you start creating stuff in your head. What was happening to me is when I was going to the gym, I knew I had the aortic aneurysm. And every time I got under a bench press, I was almost anticipating, dissecting my aorta, is this it? I was like from Sanford and said, Elizabeth, is this the big one? Am I coming for you? So you can certainly start creating stuff in your head when you live alone, and, it gets late at night and something doesn't feel right. Like you have some indigestion, maybe it's a heart attack. And sometimes, initially, yes, it is good to go check these things out. But once you know what indigestion feels like, or it's not, you can't go to the hospital every single time you have a symptom. So there has to be a differentiating factor. What do you suggest for people? Because I know a few older people who really take excellent care of themselves. My good friend Scooter Honig, but he goes like probably every 2 weeks for 16 pages of blood work because he's always worried that something's going to be off. How do you stop that? Because I'm sure you're into your health. I'm into my health. And as you get older, obviously, you're going to get a little more paranoid because that's when things happen. How do you stop that tendency to think that, something's wrong or I'm dying, I better go get tests done when there's really nothing wrong with you?
So think of it like a creaky house. When you're by yourself and you're hearing all these noises that you're not used to hearing, and again, you're by yourself. Yeah. Could it be someone breaking in? Maybe. Could it be the wind? Maybe. Could it be,
Right.
the rafters?
Yeah.
Like, I mean, there's a whole bunch of things. So I tell people, okay, let's dive into this. This is where cognitive behavioral therapy comes in. And we look at what are some alternative reasons of why you might have these symptoms. And then we end up doing like a checklist. So the next time the person feels, let's say it's an issue with their chest, they're having trouble breathing, or they have some type of pain. Okay, let's go through your checklist. As far as what kind of foods did you eat before bed?
Right.
What kind of day did you have? When was the last time you had water? Like, we go through a bunch of these things. Sure. And to say, okay, was there any overlap from other things that led to, it wasn't some life-threatening kind of thing, it was this instead. Right. So it's giving them kind of a reminder through this checklist of saying, what alternatives could there be as an example? But it's also being aware of how to manage the symptoms, because some people are hyper aware when they're feeling certain kind of joint pains, especially if they've had joint pains before and it actually led to something serious. Right. So it's one thing if it's you've never had any kind of serious issues, but if you have, then you're a little bit more extra careful and you want to make sure you kind of nip it in the bud.
Yeah, I mean, like if you've ever had a heart attack or heart pain, and now every time you get a little twinge in your chest, you think you're having it's happening again to you. I always tell people the glass of wine test. Have a bottle of red wine in your refrigerator, and when you feel stress, anxiety, or you think something's wrong with you, because what'll happen once you think there's something wrong with you, anxiety will set in, and it will exacerbate and make all your symptoms 100 times worse. So drink a glass of red wine or a few sips, and if the symptoms all go away, then it's nothing. If it's still there and rearing its head, and you're a little buzzed, from the glass of red wine, then you might want to go to the hospital, at that point. So that's my litmus test. Have the glass. I always do the glass of red wine.
Glass of red wine.
It never fails you, So.
Well,
go ahead.
Especially
before I had the heart done, I was always like worried about the aneurysm. So I'm like, you know what? Sometimes I would feel like a little twinge or something like that, or something like hurt, into my shoulder blade. I'm glass of red wine. Oh, it's gone. I guess it was anxiety. That's it. All done.
Well, I will say, I can see that being very effective. I've never suggested that, although I'll suggest other stress management techniques, because to your point, it's coping with the stress. And learning how to, again, like I said, identify alternate kind of explanations for having these kind of symptoms.
Actually, they gave Jimmy a Xanax in the ER yesterday, and he said all the symptoms went away, and he fell asleep.
Well, to your point, he needed more sleep because he wasn't sleeping. Plus, he was dehydrated. Right. So that's going to make anyone a little off, I would think.
I'll tell you, dehydration will really make you feel bad. Dehydration and low blood pressure. Because when I first came out of the hospital, my blood pressure was really low because they had told me to go back on my blood pressure medication, and I just didn't need it. I don't know why. And so when I was taking it, I was walking around like a zombie, like I didn't even know where I was. And I knew what that feeling was. Like Jimmy would have been in the emergency room in 3 seconds if he felt like that. I knew I was low blood pressure because I tested my blood pressure. And that's another thing you can do. Have a blood pressure cuff at your house. Have a blood sugar monitor at your house. And if you start feeling weird, check your blood sugar. Is it low? Okay. If it is, then eat something. A lot of times people don't even know they have low blood sugar, and they think they're having a heart attack or they're having a stroke or something like that. Same thing with your blood pressure. Check your blood pressure. Is it super high or is it super low? If it's either, that could be causing your symptoms. And so that might require a trip to the ER if your blood pressure is off the charts. But check these things. They're simple diagnostic tests. Check your pulse. Every Apple Watch will check your pulse. You can do it manually if you want to feel your pulse and just count beats. So if your heart rate is super high, that's a problem. If it's not, then don't worry about it. So you can do some of your own diagnostic tests at home to see if there's anything, immediately wrong with you, and if what the funny thing is, what these Apple Watches do now? They'll actually tell you if you're an AFib. So if you have an arrhythmia going on in your heart where it's not beating properly, these Apple Watches can detect that. You can put a setting on there where they'll actually sound an alarm, believe it or not. So, I mean, and you know what? I talked to the guy when they put my pacemaker or defibrillator in when I had the surgery, the Medtronic people who are the ones who make it said that they're working with Apple now, off the record, to create some new apps that will help the Apple Watch, give you some more feedback in terms of EKGs, blood pressure. These Apple Watches are going to do everything pretty much in the future. They're going to do blood sugar. And it's an amazing tool to have because you have all this data at your disposal. And a lot of times it can help avert a trip to the emergency room because you can just look on your watch and say, oh, this is good. This is good. This is good. All right. Maybe I'm not that bad. Let me do the Dave Palumbo glass of wine test and see how I feel. So a lot of anxieties can be allayed when you have data at your disposal.
Absolutely. And this doesn't apply for every hypochondriac, but sometimes they have too much time on their hands. So they get bored, and I understand doing the Google search or surfing the net, but you can get into this horrible spiral by going to one page that says you could have this, and it's obviously the worst case scenarios. I'm sure you've had clients like this too, Dave. And again, it's when you have too much time on your hands, you can overthink, and overanalyze.
I had I don't even know what happened. I don't know if I got sick, but I wasn't sick, but I was experiencing pain around the chest area here. Yeah. And I was like, and I knew I had no blockages in my heart, and I knew my blood pressure was good and everything like that. So I was like, kind of like, just like, what's causing that? And then I said, well, it's a little lower. I'm like, I wonder if, and I'm thinking my mother died of pancreatic cancer. I'm like, pancreas, it must be pancreas, right? I have pancreatitis, or worse, so it was going on for a couple of days, and I never get I don't eat anything that's spicy. I don't get like acid reflux ever, really. And I went and I called my cardiologist friend up. Luckily, I had him on speed dial, and he sent me for a CT scan of my abdomen, chest and abdomen, and it was clear, which gave me a breath of fresh air because I knew I had nothing growing in there. My liver was fine, my kidneys were fine, my pancreas was fine, and stomach was fine. And so, but I still had the discomfort there. It wasn't like that took the pain away from me. And I took a few antacids, like a few Tums, and I did some probiotics. And I think the probiotics are what cured me, but I had it for about 5 to 7 days. And I don't know what it was. I wasn't sick. I didn't have a fever. It was the weirdest thing. It just came and left. As quickly as it came, it left. And I don't know if it was because I took some Boswellia, which is an anti-inflammatory, and it just went away. But I was concerned enough because I actually was feeling pain. And, in that case, that's not being a hypochondriac, because that's something that's not normally in your body. And that's something that's lingering around for a couple of days. You want to address that. But, too much is when every single day you're coming up with a new symptom. And that's not so great. And so you have to be able to differentiate between the two. And if you're one of these guys that your friends are teasing you because you're in the emergency room every single week,
Jimmy,
that might be a little telltale sign, Lesley, that maybe you're getting a little too crazy, right?
Maybe. And again, it doesn't mean you're a hypochondriac on every particular situation, right? But for there are people who are overly, let's say, they had a little bit of shortness of breath, and they, because they were tired because they just did a cardio session. Well, right. Of course you're going to be out of breath.
Right. But you know what I'm saying? That there are people that literally are at the doctor every single week.
Yeah. Yeah.
With not with the same symptom, with a new a new problem they have. One week they think they have kidney stones. One week they think they have pancreatic cancer. One week they think they're having a heart attack. Another week they're having a stroke. Another week they have a brain aneurysm. So that's a terrible. You can't live like that. That will drive you nuts. And I guess the final thing I want to ask you is, if you are in that situation, in that category, how do you get yourself out of that feeling like I'm always having some new disease pop up in my body? Because I mean, whether it's due to boredom, like you said, or it's due to the fact you have too much time on your hands, or the fact that you're just overthinking things, how do you get out of that mindset?
There's some questions that I actually ask clients, and one of them is, what would happen if you weren't sick? How would your life be different? Because usually there's an underlying cause as far as I'm not talking about, necessarily life stresses per se, but they haven't accomplished certain things. There's some unfinished business that needs to be addressed, whether it's from their past or they're not happy where they are in their life, whether they need meaning in their life, whatever that might look like. But there's a reason why people are unhappy, whatever that unhappiness looks like. So right now we're talking about the illness anxiety disorder, but it's finding out, what if that was not part of your life? And it's usually because people are afraid to overcome something, and it's identifying what that is. So that's where the therapy can be very helpful.
Do you think some people are like almost like creating these illnesses because they're trying to avoid dealing with something else in their life that needs resolution and they haven't resolved it, or they're afraid to resolve it maybe?
Yeah, for sure. I mean, I've had clients like that. It doesn't mean they're necessarily aware. It's not like, oh, I want to avoid this, let me make this up. Right. It's not a conscious thought. But yeah, that's a big piece of it.
Maybe someone has a bad relationship with a marriage or something like that, and they don't want to deal with it, so they create all these illnesses to like kind of like subvert them from actually the reality of what's going on, maybe.
Or getting attention from their partner. I mean, like there's a whole bunch of reasons, but yeah, that's a big piece of it.
Okay, well, that's good information. So hopefully you guys out there will take that, process it. Remember, I'm not telling you not to go get checked out if things are not right. That's not what the message is. However, if you're overthinking things, or you're always thinking you're getting sick, and maybe you're even stressed out and have anxiety about it, there's something you can do. There's someone like Lesley you can talk to, or maybe use some of the techniques that she addressed in this episode. Thank you, Lesley, for informing us on that, because sometimes I can border on being a hypochondriac too. So don't feel bad about it, because we all get, and especially as we get older, I notice my friends that are in their 60s I see they're a little more worried about things nowadays, because they realize, hey, I'm 60 years old. I'm actually not that young anymore. And things might happen to me. Oh my God, and I, you know what they do? They call me first, Lesley. They're like, what do you think about this? What do you think about this pain I have? Or what do you think about this blood test that came back? And so, which is fine. I'm good, especially if they're my friends, I have no problem, giving them the right advice, but sometimes, you got to go and check it out. And sometimes, you know what, you do the red wine test, and if that works out in your favor, then you stay home and you watch TV. That's all. All right, guys. If you have any suggestions for future topics of future shows, put them in the comments below, or let Lesley and I know directly, and we will absolutely address them. For now, though, we're out of time. I'm Dave Palumbo with Lesley Timbol for another installment of Iron Therapy.
Take care, guys.